Hi everyone, I'm Dr. Sonja Rosen. I'm a geriatrician and I work at Cedars Sinai. I'm the Chief of Geriatrics at Cedars Sinai, where we have a dedicated geriatrics program to help take care of our older community. We take care of everyone from 65-year-olds who are still working full-time to people over 100. So really the full spectrum of older patients. And we have myself, Dr. Allison Mays, Dr. Elizabeth Whiteman are all geriatricians here, as well as a geriatric pharmacist. So this month is Healthy Aging Month, and I'm here to answer your questions about how to age healthy. So please type in your questions for me.
Okay, what's a geriatrician and when should I see one?
So geriatricians are physicians who have specialty training in taking care of older patients. So we've completed either a residency in internal medicine or family medicine, and then a fellowship in geriatric medicine. And we have specialized training in what we call different geriatric syndromes. So these are things such as falls or functional decline, social isolation, polypharmacy or being on a lot of medications, any memory problems or dementia, depression, and also goals of care discussions. So you can see a geriatrician if you just want a primary care physician to take care of you and in a comprehensive way if you're 65 and older. But you can also see a geriatrician for a consult if you have a primary care physician and you have one of the problems that I mentioned. For example, falls. A lot of older people think that it's normal to fall with aging, and while it's really common, it's actually not normal. So if you have a history of falls, you should talk to your doctor about that and be evaluated. And you can be evaluated by a geriatrician.
What can I do to live longer?
So one of the most important things that everyone can do to live as long and as healthy as possible is to exercise. And really we have a goal to exercise 45 minutes a day, 5 days a week. Exercising helps prevent memory loss. Exercise helps improve your brain health and your heart health. And actually, exercise is the only thing proven to prevent falls.
Okay. How should I change my exercise habits as I get older?
So it really depends. If you're a very physically active person, when you get older, there's no reason that you can't continue to be physically active as long as your exercise feels good and it's not hurting your body. If you've never been a physically active patient, it's never too late. I have some patients who start getting physically fit in their 80s and 90s. We have a grant at Cedars Sinai Geriatrics with the AARP Foundation titled LEAP, or Leveraging Exercise to Age in Place. And we have exercise classes at no cost throughout our community at 9 different sites where anyone over 50 actually can come and exercise with us.
If I don't exercise now, how should I start?
So anytime you're considering a new exercise program, you should always talk to your physician about that first. You want to make sure that it's safe for you to start a new exercise program. And then in general, sort of start low and go slow. So graduate that exercise slowly. For an individualized program, you really should talk to your own physician. But in general, we like to sort of increase in small increments. So for example, if you don't usually walk, and you don't have any contraindications to walking, you can start by walking 5 minutes a day, and then the next week increase that to 10 minutes a day with a goal of 45 minutes a day. If you can get there, it's great for you.
Should I change the way I eat as I get older?
So getting older doesn't necessarily necessitate needing to change the way that you eat, but it is important to always eat a healthy, well-balanced diet, and ideally full of whole foods. We really are trying to get away from processed foods at really any age, and eat more whole foods that aren't processed, and diets low in saturated fats are the best for you.
What are the contraindications to walking?
So some people have a lot of difficulty walking if they have a lot of joint problems. So for example, if you have a lot of pain when walking, then there's something wrong, and you should talk with your doctor about it. Your doctor will evaluate the problem and let you know if it's safe to keep walking, or if we need to evaluate what's causing the pain that's making it difficult for you to walk. And really, anytime there's something that's preventing you from doing something you want to do or participate more fully, you should always tell your doctor and not assume that it's just something that's normal with aging, but tell your doctor, because it might be the sign or symptom of something that is abnormal, but something that we can treat once we figure out what it is. But your physician won't know unless you tell them.
Should we be counting macros? Sorry, should we be counting macros?
What is that?
Like, we can skip
Okay.
that. Yeah.
Okay.
April asks, do antioxidants really do anything to help with aging?
Well, antioxidants haven't. So the question was, do antioxidants do anything to help with aging? And there are so many benefits to antioxidants in different ways. For example, blueberries are a great whole food that's full of antioxidants. They're very good for your liver, and they're low in sugar and high in fiber, so they're just good foods for you. But there isn't any evidence that antioxidants per se will slow or prevent aging.
We have a question from Laura. She wants to know, how do I know when I should be consulting for a geriatrologist about my health issues rather than my PCP?
So Laura wants to know, how does she know when she should be consulting with a geriatrician versus continuing with her primary care physician? So there's really no there's no absolute guideline. So if you have a geriatric syndrome, so what the ones we talked about are falls, functional decline, social isolation, polypharmacy or being on a lot of medications, depression, memory loss, or dementia, or a delirium. If you have any of these issues, then it's a good idea for you to see a geriatrician for a consultation. We also, though, provide primary care for our patients, and so we take care of people from 65 years old when they're really healthy and high functioning, and focus really on maintaining your health and preventing disease, to people all the way over 100. And a lot of patients seek out a geriatrician because they want a physician who's going to focus on keeping them healthy for as long as possible at any age. It's really your personal preference for primary care. There are so many great primary care physicians who might not necessarily be geriatricians, but they take wonderful care of our older patients. And so it's really a personal decision.
Okay, we have a question from Mary Lou, who wants to know, is it necessary to take vitamins for older patients?
Yeah, so Mary Lou wants to know if it's necessary to take vitamins when you're older. Basically, there are some vitamin deficiencies that are more prevalent when people get older, and specifically those are B12 deficiency and also vitamin D deficiency. And then there's some other some minerals that patients can be deficient in, but your physician will check for those, and if you're deficient, then you need a supplement. If you eat a well-nourished, well-balanced diet and you're a well-nourished person, you really don't necessarily have to take any vitamin supplements. If you're not sure you're getting a well-balanced diet, a multivitamin is always a safe way to sort of cover the bases, so to speak, if you're not sure you're getting a well-balanced diet.
When should I be worried about memory loss?
So someone asked, when should I be worried about memory loss? And this is one of the most common questions that I get from my patients. And memory loss is often a normal process with aging. And let me explain that a little bit better. When people get older, there's a normal age-related slowness and forgetfulness that occurs, actually, interestingly, with each decade of life. So if you can still do the things that you want to do, but it just might take you longer, or if you remember the name but it might take you a little bit longer, that's probably normal age-related memory loss. When it's not normal is when it's interfering with your daily life or your functional status, your basic activities of daily living, so taking care of yourself in your home, or more complicated, what we call instrumental activities of daily living. So if you're having difficulty paying your bills on time, or driving, or you're getting lost while driving, or you've had car accidents that you really can't identify whose fault it was, difficulty shopping and organizing your life, then that can be a sign that there could be more going on with your memory. But really, you need to tell your physician if you're having anything like that, any symptoms like that, because your physician can either evaluate you or refer you to a specialist, like a geriatrician, to evaluate you for the memory issues. There's a lot of things that can cause memory loss that are totally reversible, like B12 deficiency, or even depression can cause what we call a pseudo-dementia, or memory loss that is treatable once we treat the depression. But the first thing is to tell your doctor what's going on.
Okay, we have a question from Aubrey. She wants to know, are you seeing an increase in sarcopenia or dynapenia in the elderly population?
Hi, Aubrey. Aubrey wants to know if I'm seeing an increase in sarcopenia in the elderly population. And I really can't say that I am. It's also not, I'm not a specialist in that area, so I can't really speak to that. But from my own experience, no.
Okay. Back to the question about macros. So Julie's asking about protein, fat, and carbs. Like, is that something that you need to be worried about?
Oh, yeah. So Julie's asking about specific diets, I think, for healthy aging. Yeah, and there's so much, I think on a daily basis we hear a lot of different information about what's the healthiest diet. For example, the Mediterranean diet, and how much protein should you have in your diet. And I do have to share that I am not a nutritionist, so you might get a more detailed answer to your question for your own self from a nutritionist, I think. But in general, a diet that's low in saturated fat, that's more consisting of whole foods and not processed foods, is the healthiest diet for you. So low in saturated fat, well balanced, not too much of anything specifically. So not all protein, not all fruit, but really a balance of everything, and then staying away from processed foods as much as possible, because it's hard for the body and the liver to process processed foods.
Okay. What are some common complaints that you get from your patients?
So the question is, what are some common complaints that I get from my patients? I think a lot of my experience is that a lot of patients want to know if something is normal with aging. And, for example, we talked about memory loss. Is that normal with aging? And it certainly can be. And another one is falling, if that's normal with aging. And it's not, but it's very common. So sort of sorting out what's common, but also needs to be evaluated. Another common question is whether or not patients need to be on as many medications as they are. That's something that I see almost every day, is patients who are on, sometimes an average of 15 medications, and they would like to decrease some of those medications, and they want to make sure that they're all necessary. And it's really important to do that regularly with your primary care physician, because it might be that you've gotten some medications from some doctors and other medications from other doctors, but that there isn't necessarily one. Yeah, you have to make sure your doctor, your primary care doctor, knows about all of the different medications you've been receiving, so that they can review them all, make sure they're all appropriate, make sure there aren't any drug interactions or drug disease interactions, and make sure that each of those medications is appropriate and that you need to continue taking it. So those are probably some of the most common questions that I get.
Okay. We have a question from April, who wants to know, do you have any suggestions for opening up a conversation with your parents about having an advanced healthcare directive?
Yeah, thank you, April, for that question. So April's question was whether or not I have any advice about opening up a conversation about advanced directives or goals of care planning. And actually, I should have added that as one of the most common questions that I get, certainly one that I talk about every day. It's so important, and I just want to thank you for that question, because it's so important to know what your loved one's goals of care are. If you're the closest person to them. So you might be your parents' durable power of attorney, which means that if they couldn't make a decision for themselves, you would help make that decision for them. You might sort of act in that role, but it hasn't necessarily been made official yet or formalized in the form of a durable power of attorney. And you want to make sure that your parents understand the importance of that. So I would recommend, talking about how important it is as your parents, for example, closest loved one, to know what their wishes are, because what we want to do as loved ones, first and foremost, if we're helping to be responsible for our loved one's care, is to honor their goals of care. So you want to ask, it's helpful to frame the conversation in terms of wanting to honor your loved one's goals of care. And in order to do that, you really need to know, we want to have a conversation about what their goals are. And your physician can help have this conversation. Your parents' physician can help have this conversation with your parents. So I would start there, and if it's uncomfortable sort of having that conversation alone, you can bring it up to your parents' physician if you're able to go to an appointment with them, or ask them to talk about it. But it's very important to know what your loved one's goals of care are.
Okay, we have a question from Rodney. Other than memory loss, what are other signs and symptoms we should keep an eye out for?
So Rodney asked, other than memory loss, what are other signs and symptoms that we should keep an eye out for? So that's a great question. I think probably one of the most common ones, and I mentioned this earlier, is really falls. A lot of people think that falling is normal. With aging, as I mentioned, it's common, but it's not normal. And so, people can just trip, and that's sort of a fluke, but sometimes falling is a sign of something else going on. Like, for example, a balance problem, a gait problem. It could be something neurologic. It could be something anatomical, like arthritis, or something where people have decreased sensation, like something called a neuropathy, or it could be issues with vision as well. And it could also be an issue with shoes and footwear. So there's a lot of possibilities, and most of the time there's something that we can find that is intervenable, that we can intervene upon, that can improve the risk of falling. The most important one really being exercise. So in terms of what are other things to watch for, falling is one of them, memory issues is another. Another really important one that we're talking about more in our national conversation is social isolation. And social isolation or loneliness is really, it's a national epidemic, but it's also a worldwide epidemic, and there's a lot of different reasons for it. People can actually not necessarily live alone, but they still feel lonely and socially isolated because they're not engaging with their social network or their peers. And we actually know that being socially isolated correlates to not seeing your doctor regularly, not taking your medications regularly, not eating well. In fact, being socially isolated is associated with a 50% higher risk of early death. Another really astounding statistic is that social isolation is the equivalent of smoking 15 cigarettes a day in terms of a health risk. So what does all this mean? If you're finding that you are more and more isolated, there are a lot of ways to get engaged. First thing is to tell your doctor how you're feeling. As I mentioned, here at Cedars Sinai, we have a grant through the AARP Foundation to help combat social isolation and help prevent falls. And we have 9 wonderful exercise classes as well as 1 chronic disease management class that are running throughout the community at 9 different sites for the next several years. And they're at no cost to our community. And if you're interested in that, you can certainly call us and let us know, and we can help connect you to some of those classes. But that's a wonderful way, participating in a community exercise class or community group, to help combat social isolation and be healthier.
Okay, we have a question from Julie. Does fish oil help memory?
Julie asked if fish oil helps memory. And I'm sorry, Julie, but there's no statistical evidence in randomized controlled trials that fish oil helps memory. So I think there previously was some thought that it could help, but in fact it doesn't help. So it's not necessary to take to prevent memory loss.
Okay. Julie had another question. Yeah. She said she's seen studies about pets and the elderly. Do you have an opinion on that?
Oh, that's such a great question. So Julie was asking about pets and the elderly, and really, if what it comes down to is that if having a pet is positive experience, which it is for a lot of people, then that's wonderful, because that increases your endorphins and it helps combat depression and loneliness as well. So pets can be wonderful.
What are some common misconceptions that people have about geriatricians?
Oh, so what the question is, what are some common misconceptions people have about geriatricians? I think I have to think about that. I can share sort of what our philosophy is in geriatrics. In geriatrics, we really focus on treating the whole patient and really looking at every aspect of a patient's care. So not just the physical well-being, but the emotional well-being, the environment that our patients live in, and the overall picture of our patient's health. And it might surprise some people that geriatricians really, our focus is to help keep people as healthy as possible for as long as possible. So we're looking to prevent disease, to maintain health, and really ensure that the quality of life at every decade of life is optimal. And that's it. We're out of time. If you want to learn more, you can follow me on Twitter at Sonja Rosen, MD, SONJAROSEN, MD. And if you want to schedule an appointment with a geriatrician, you can call us at 1-800-CEDARS-1. Thanks so much for talking with us.